Thank you, Dr. Coe, Mr. Munson, Dr. Johnson, and Ms. Hobson for your outstanding presentations. If you've not already done so, I invite participants to send their questions through the WebEx chat feature. During the question and answer period, you will be prompted to fill out a survey about your experience with this webinar. We strongly encourage you to complete the survey so that we can continue to improve the quality of these webinars in the future. Thanks in advance for your feedback. We have a limited amount of time for question and answer, but the first question I'll direct to Dr. Coe. What are the unique features of the leading health indicators, and why should stakeholders use them?
Well, the leading health indicators represent a set of high-priority health areas representing major opportunities for action for the country. So we view the LHIs as a way to align efforts for people who care about health across the country, drive action, and then, as you saw through this presentation today, serve as an opportunity to share lessons learned from the field. So this is a great way to bring us together as a public health community going forward.
Thank you, Dr. Coe. We have a number of questions for the Southside Healthcare Collaborative. First question from one of our participants: how are you establishing these ongoing relationships?
So we have regular meetings of the collaborative, and we also have subcommittees or working groups of the collaborative as well. And so that, of course, brings us together and helps us stay unified with goals. In addition, we ask sites to sign a memoranda of understanding, so that way there's some definition of what our responsibilities are.
Thank you. Another question for the same group. Can the patients look at their own data via the PHR of some sort, or health record?
So the answer is right now no, but many of our sites that are in the collaborative are moving, of course, towards EMR. And as part of some of the EMRs, it will be possible for a MyChart kind of function, where individuals will be able to look at their charts on their own.
Great. One more question. How are patients paired up with a primary care doctor?
Well, there are criteria that are used, but of course, first and foremost, we start with the patient. We show them a list of the various sites that are available. They are then able to see a map which shows the geographic location of them. And then finally, the state of Illinois, as part of its Medicaid program, assigns providers to patients. As a consequence, some of the time what we're doing is, so to speak, introducing that provider to the patient. Of course, they're able to make change, and we would never get in the way of that. So we just explain to people how they can go about doing that if they wanted to change their provider. And so all of those wrap together in terms of leading to that kind of connection.
Thank you, Dr. Johnson. I'll field the next question. The question is, will the presentation be available after the session? And the answer is yes. The slides will be emailed to all the attendees, and the webinar will also be archived on the Healthy People website. Unfortunately, this session is coming to an end. I want to thank you for joining today's webinar. This webinar is part of a series, and we hope that you'll continue to join us. To receive notices about upcoming events, please sign up for our email announcements on the Healthy People website. That is healthypeople.gov. You can also check healthypeople.gov for a recording of today's presentation. Let me end by saying that on behalf of HHS, I would like to thank all of you, the presenters, as well as everyone that's been involved with the planning and implementing of Healthy People 2020. Thank you.